Hi, everyone. Here is my disclaimer. Any information discussed in this interview may not be the views of the station or host. Please discuss any information with your primary care physician. Hi, everyone. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio, where our mantra is to educate, enlighten, and entertain. I had 2 public service announcements, well, actually 3, before I bring on my guest. First one is, as everyone knows, it is November, and it is National Caregivers Month. Let's honor a caregiver. If you know a caregiver, please reach out to them. Let them know that you care. It would mean so much. I'm saying that as a former caregiver. It's really important to maintain that contact and have that support from people. And it is also National Alzheimer's Awareness Month. Those who have gone through that journey will never forget it. Those who have Alzheimer's or are taking care of someone with Alzheimer's, please share your story. And my heart goes out to you. Please speak up. We learn from our stories. We learn from each other's stories. And the only way the public is going to be educated is if we put a name and a face and personalize this disease. I'm very passionate about that because I've been a caregiver to people who have had Alzheimer's. We need to personalize this disease. Don't be afraid to post on your media. Show your journey. I showed my husband's journey, and I'm glad I did because people learned from Matt's journey. So please share your stories. Also, if you're looking for a support group, I have one, #Kick Alzheimer's Ass Movement group on Facebook. You don't have to have Alzheimer's. If you're a caregiver, or even if you're not, you can join my group and become educated. Because I'll tell you what, folks, if you haven't already been a caregiver, chances are you will be or you will need one. Educate yourself about the number 6 killer, Alzheimer's. It is a global epidemic, which there is no cure. Now I'm going to introduce my guest. I'm so excited, folks, because I do have phenomenal guests, and I'm so glad I met my guest, I think it was over a year ago, in a clubhouse room. I have with me today Dannelle LeBlanc. She is a certified senior advisor and caregiving consultant. She has over 20 years' experience as a professional. She also has had personal experience as a caregiver. She is founder and owner of Caregiver Transitions, LLC, which is a grant award recipient of the North Central Texas area Agency on Aging to deliver training to those who care for and or work with older adults. Dannelle is also creator of the Caregiving Community Guide and host of the Caregiving Soul podcast, which she's going to talk about. And I'll tell you what, folks, it takes a village. It takes a village of support for caregiver. And I want to welcome Dannelle LeBlanc to Chatting with Betsy.
Hi, Betsy. Thank you so much for your invitation. I'm so excited to be here.
Well, you are welcome, and thank you for accepting my invitation. Dannelle was supposed to be on my show, I think, back in August. I forgot,
yes.
But August, wow, time goes by, and I say, you know what, it worked out because this is National Caregivers Month and National Alzheimer's Awareness Month. So it
yes,
just
it worked out great, actually.
Yes, so it just worked out. So, Dannelle, I know you are a great resource, so I'd like for you to tell the audience about your business. How did you start it, and how do you help people? And is it just local to Texas, or can you help people throughout the U.S.?
Thank you for your question. Bless you. So,
welcome. Thank you.
I started. So I am a regular person who had the experience of caring for a family member. For me, it was my father-in-law who had Parkinson's disease. And so over a period of about 12 years, I became his primary caregiver. And throughout that entire time, Betsy, I had no idea. I'd never heard of the term family caregiver. I did not have a name for what it was that I was doing, caregiving. I didn't even have the name caregiving to define what it was that I was doing. Like most of us, I was just loving and caring for my father-in-law because of our relationship. And so it wasn't until after he passed in 2017 and the roller coaster stopped that I realized that I had been on a ride. And it was only when the ride came to a stop that I was like, okay, so do I get off? I'm getting off of this ride that I've been on. And there was a toll for me physically, emotionally, and I felt that I realized that with him being my father-in-law, that there was no way that I was the only person who had gone through something like this. And so
true.
I had, yes, because
you know what,
I've
done that. I have to stop you right there if you don't mind, because what you said is so true. It is a roller coaster ride, and we think that we're alone, don't we? But we're not. We're not alone. And I just wanted to say that I thought I was alone too. You know, when my mother-in-law started in 2000, there wasn't information. I didn't think of myself as a caregiver. You know,
right.
So go ahead. Yeah, that's very true, and it does take a toll. Thank you for bringing that up. It does take a toll on all levels. Go ahead, Dannelle.
Absolutely. It takes a toll, and we have our reasons for why we do what we do, for love, for obligation, because it's the right thing to do. There's a whole host of reasons why we do what we do, and it's different for everyone just depending on what the relationship is like. But that roller coaster ride can be so disorienting, and when it happens over an extended period of time, a lot of times we don't realize what the toll is because it's incremental. And that's why the kind of work that you do, that I aspire to do, is so important to help people to define what it is that we're doing, its value for not just the person that we care for, but to society as a whole, how we can walk through the experience and remain whole ourselves, and if we are not whole, how we can recover our wholeness. So this is all in retrospect, Betsy. Okay, so just so you know, this is not something that I realized, right after my father-in-law passed. This is something that, I have learned through over time. And so I really wanted to find a way to help and inform and educate other people who were walking through a similar journey, caring for a loved one or a friend. And so I started doing my research to try to figure out, okay, what don't I know? Because none of us know everything, right? We have our personal experiences. Right. We may even have a professional experience. So in my case, I had a background working with patient support services and education and training. However, there's so much more that I didn't know. And so I wanted to do my due diligence. I went through the Certified Senior Advisor Training Program, which is through the Society of Certified Senior Advisors, so that I could have a better understanding of all of the challenges, not just with daily personal care, but to also better understand things like potential benefits, financial considerations, insurance, what happens in the body as we age, and to better understand what's happening and be able to address those issues. So it's a comprehensive training program, so I went through that, and then started to connect and reach out to other people who were in the caregiving space and learn from their experiences and expertise, figure out how I wanted to help other people because, it can be overwhelming to turn around from a caregiving experience and then come into this space wanting to help individuals. And that also is a form of caregiving because you're providing emotional support. So when I started, I wanted to do one-on-one individual support and found myself again overwhelmed because so many of the people, the majority of the people that I was helping did not have the ability to pay me. and so I wanted to help them. And so I didn't have that as a requirement of whether I help someone or not. And so I thought, okay, it's not sustainable. So how can I help individuals? How can I reach more people in a way that is sustainable and that is also going to provide an income? Because there's only so much volunteer work you can do, but your mortgage company, your mortgage lender is not going to accept, oh, well, she's passionate about what she does as a form of payment, right?
Right. That's right. that's true. That's
okay.
true. Dannelle, you cracked me up. People don't understand, you have much value, okay? So there are people out there who think, well, you shouldn't charge for helping, but you know what? When someone provides a service, they have to charge and make it sustainable to support themselves. And you go to a doctor, you pay them. If you go to a counselor, you pay them. So why wouldn't people think, okay, a geriatric care consultant, a caregiving consultant, of course you're going to pay them. They're providing a service. I just had to add that in because, for some reason, and I have seen this in groups, caregivers think it should be, for free. No, you're paying a service, and people have to charge. They are providing a valuable service, and that's just my 2 cents. Go ahead, Dannelle.
Yeah,
I had to add that.
Yeah. No, so trying to find that balance, and so that was part of the reason why I applied for, submitted a proposal and applied for caregiver instruction and training through my local area agency on aging, because I thought, okay, so if I shift my approach and I go through an agency or organization that provides compensation for my work, then I had the ability to pay my bills and also to reach those who just may not have the funds because of, for whatever reason, and still be able to sustain my work. And so that's how Caregiver Transitions was founded. And so since that time, I've done trainings through the local North Central Texas area a few years ago. And Texas is a big state. And here in the North Texas area, the service area for North Central Texas spans from one end to the other, 3.5, 4 hours. And so I drove to these, many of them were actually rural areas that were not as connected to the community resources as the more metro or city areas in the North Central Texas area, and so it was a great learning experience. I enjoyed it so much. And so you mentioned if it was just the services are available locally or nationally. One of the things that I did was, in order to, again, back to the idea of, as you mentioned, it takes a village, and none of us have the ability to provide the right kind of help for everyone. But how can we better connect people to the community resources that aren't necessarily us, but all the other services that are available. And so I created the Caregiving Community Guide. The first edition came out in 2019, I think it was, but it's a comprehensive resource guide for caregivers that not only focuses on health and community resources for the person that we're caring for, but also for us, because that was what the piece that was missing, was the resources for us as caregivers for our well-being. And so I customized it for each of the North Central Texas counties that I was working with. And then I think it was a year later, or later that same year, I created a national version. And so, and all of the versions are available as a digital download at my website, caregivertransitions.com. It's free for anyone to access. And it's also another thing that is, I feel, important for caregivers, is that those types of resources be inclusive, so that, the majority of the people that I was providing services to were caring for someone who, for an older adult, because it was through my local area agency on aging. But in the guide, I included wholeheartedly, so not just like as an aside, but resources for people who are caring for a family member or friend for a variety of reasons, whether it's, due to a decline related to age, or if it's someone who's caring for someone with a disability, special needs, chronic illness, all of that is included. And then also inclusive in the sense that we all have different experiences based on our backgrounds, our faith, where we live, geographic, so many different nuances to our experience based on who we are as a person and our life experience. And so it's also very inclusive for people of color, for LGBTQ, for people who live in rural areas, and it's just very important for me that the resources that are provided that are not limited to my own personal experience and who I am, but are relevant for people with different life experiences.
Oh, I love that, Dannelle. I think that's wonderful that you did that. And I live in New Jersey, which is a pretty metro, busy area. And I have found, even with my own experience, I wasn't aware of services, of resources in my area. So I think that sometimes people are not aware of their local resources in their own backyard. So, you
so
have
true.
this, this guy that you have is, to me, and it's free, that is just like so generous of you, because information like that is priceless. We need to know resources in our area. When I tell people about resources in our area, when they ask, they never heard of it. As a matter of fact, we never heard of it. I'll give an example. When Matt was alive, I think it was 2018 actually, Matt was going on a Medicare, prescription plan. And my pharmacist said to me, Betsy, why don't you go to the senior center? They'll help you with that. And I went, really? Where is that? I didn't even know where the senior center was. And I found out they had the SHIP, they will counsel with you and help you. And they offer free counseling. I'm getting free grief counseling through my senior center.
Yes. Okay, so you mentioned the SHIP. So let's make sure that everyone knows what that is. So you guys, your local area agency on aging has benefits counselors that can help to educate and walk you through eligible benefits through Medicare, Medicaid, Social Security and disability, prescription drug services, a host of other benefits that may be specific to your local area, your local area. And so this is free counseling. They're not going to tell you this is the plan you should get, or anything like that, but they're going to help provide you with the information that you need in order to make an informed choice. And my goodness, I mean, if you're caring for someone, or you yourself are of an age where you receive that big old packet of Medicare, I mean, it's overwhelming. I mean, nobody's reading that actually. How are you supposed? That is okay, there it is in black and white. Nobody is reading that book, okay? Because it is too much. It's too overwhelming. And so, you just kind of end up making the best decision you can based on, your budget and what you do know and what, your loved one may have already had in place, et cetera. So you're kind of making a piecemeal decision, which is the best we can do without support. And so this is a huge resource. I'm so glad you mentioned it.
Yeah, as a matter of fact, I'm going next week. Can't believe it. I'm going next week to speak to a counselor at my senior center to go over plans and prescription. And also, Dannelle, according to your local area, they can even tell you about subsidies for your electric, if you qualify, heating, services available. I mean, and people do not know about this. So when I found that out, I was like, wow. When I went down for Met for the first time, the social worker said, we even do counseling. I said, I'll keep that in mind. And I did. I can't afford insurance. I mean, I can't afford counseling in my insurance. So, hey, folks, this is my attitude. You're paying taxes, and I know here in New Jersey we're paying through the nose. Take advantage of every free service you can get. You're paying for it with your taxes.
Free. Right, because it's not
right.
actually really free. We are actually paying for that.
Right.
And so to just piggyback on your point about help with the subsidies for housing or help with your electric and, getting ramps installed, those sorts of things. Also, you can get information about that, not just through the Area Agency on Aging, but also a lot of states and cities or regions have their Aging and Disability Resource Center, and it may be called something different depending on where you live, but I'm just quickly making sure that this link is still updated. Okay, so if you go to usaging.org, then there are links to these, find these resources, and to also find your local agency. But like Betsy said, you just do a search for your local senior center. They can also provide this information to you directly. So, yes. Oh my gosh, huge resource. We missed out on.
And actually, like your Office of Aging, every county has an Office of Aging, and you know what? Call them, find out where you are, wherever you are, and I'm talking about the U.S. only. I don't know about overseas, but they can give you information. When Matt's mom, she was diagnosed, I called them up. They came and did an intake, and she was able to get a subsidy for 3 days a week, either a person, or to go to a daycare, where she paid half the price. So, there's things out there, and we don't know until we ask. Now, Dannelle, do you personally counsel with people and help people find services?
So so that's where I started. And that, because of the overwhelming number of people who needed that type of one-on-one counseling, that was actually the inspiration for creating this caregiving community guide, so that people could find for themselves, for example, benefits and social services. So as an example, in the guide, in the section on benefits and social services, there are, at both the national level and also at the local level, information and links to, and you can like find what you want, which section you want in the table of contents. But, so in the table of contents, there's a section on benefits and social services. It'll have a listing for the National Association of Area Agencies on Aging, provides a description of, okay, this is what you can find here, a link to go there. It would include information about resources like Benefits Checkup, benefitscheckup.org, which is another great way to do a comprehensive benefits search. It's basically an application tool to find specific financial assistance and services that you and your care recipient, your loved one, can qualify for in your area. So the answer to your question is yes, but I've just found a way to do it that was sustainable for me because of basically it came down to time resources and lack of financial resources, finding, okay, how do I do this? How do I connect people to these resources in a way that is sustainable? So when I do the training courses, then it ends up being, kind of like a group session where, people may ask specific questions, and the answers that I may or may not have. And when I don't have them, then I can either research them or find someone who knows. So that's also a great benefit of like working in this community. And one of the things that I love is that because I don't know everything, I have a wonderful network of people who I know that I can ask. And so that is something that is not just critical in the kind of work that we're doing now, Betsy, but also for us as caregivers, because there's no way that we're going to know everything. It's just not going to happen. So building your network of people who you can ask. So like your pharmacist who told you about going to your senior center, or whether it's, a medical provider, whether it's a neighbor, the huge, huge value of being connected to some kind of support group, like the one that you lead, Betsy, is so critical, because that's where you can find a lot of the folks who you can ask. Your CPA, okay? So it's not about knowing everything, but it's also about knowing who to ask.
Yes, and education, I always say education is very important for caregivers, or even if you're not a caregiver, because you will be one day. I could almost guarantee it. And we need the information. And this is one reason why I do my show, is to provide resources, to let people know they're not alone, give them information to make their life a little better. When a caregiver is educated, they will be less stressed, and they will be able to help their loved one so much more better than if they're not educated, because they'll know what to expect. They'll know how to deal with behaviors. And it doesn't come overnight, folks. Trust me. I mean, I wish there was information. When I started with my mother-in-law 20 years ago, 20 years ago, but there wasn't. And I wish there was. I was much more educated with Matt and I was able to help him and handle his behaviors much better because I was educated. And Dannelle, this is just my own personal opinion. If I was to seek someone to hire to help me navigate, I want someone who walked the walk, not just talk the talk.
Oh, yes. Yes.
I want someone
absolutely.
experienced, because there's a difference.
Yes.
You know, I do believe that.
No, there absolutely is.
Yes.
Yes. Absolutely. So, you know, there is huge value to lived experience. It doesn't matter, and that's true of just about, you know, anything. You know, when you have actually walked the walk, it's not only are you more likely to be connected to resources that actually make a difference and that work for a caregiving situation, but also you have the experience of the emotional challenges that we go through. So there's a compassion and an empathy that is at a different level, and it can be so wearying to have to explain how exhausted or overwhelmed or uncertain we feel to someone who doesn't have that lived experience. And so it can be such a relief when you are working with someone or just sharing with someone who already gets that part, right? They get it.
Yes, I so agree. Dannelle, I want you to talk about your podcast. Time goes by so fast.
I know. I'm like, oh my goodness.
People say, when I tell people, you know, my show is like 40 to 60 minutes, they're like, I can't talk that long. I said, yeah, with me you can. It goes by so quick because there's so much to talk about. And, you know, I like to encourage people to listen, you know, to other people's shows because, like I said, it takes a village.
Yes.
I don't have all the answers.
Yes.
I want people to be educated. So I like to know about Caregiving Soul podcast. I love the name of that, by the way. That's a great name. And where we could find it and, you know, what your show is about. I don't even remember if I listened to your show, to be honest. If I did, it was so long ago, but I'll have to check it out again.
Yes, absolutely. So the podcast is called, bless you, the podcast is called The Caregiving Soul, and it's through the Empowered Us Network, which is led by Good Days. And just to provide some background here on the podcast and what we're doing through the Empowered Us Network is Good Days, mygooddays.org, is a charity organization that provides assistance, support, advocacy for people who are living with chronic or rare disease and their caregivers, and what they do, and it's not just what they do, it is how they do it, is amazing. I admire their work so much. I have relationships with the people who work there, and so know them on both a personal and professional basis. And so it is just an extreme honor for me to be a part of this new initiative, the Empowered Us Network, and basically Empowered Us is a storytelling resource hub led by Good Days. And we're looking to explore the challenges and opportunities of the healthcare journey, share solutions for not just Good Days community of patients, caregivers, and health professionals, but beyond. And so you can find the Caregiving Soul podcast on wherever you get your podcasts, but the hub is at empoweredus.org. And the show is intended to help people walk through the physical, emotional, and logistical challenges that we encounter as partners in care in a soulful way, because that's who I am, okay? So I walk through, we do the work of caregiving. So many of us, I think most of us, lead with our hearts. We walk through with our hearts. And I think that is also the reason why it can often take such a toll on us, is because we are we're walking through that journey, that experience with our hearts. And so we can forget, oh, you know what? I also need to make sure that I'm taking care of my physical self. I need to make sure that I am taking care of my financial well-being. I need to make sure that I am, I have balance at work and in my other relationships. And so with that understanding that when we're leading, when we're walking with our hearts at the forefront, that we are also human beings that, have material needs that we need to make sure that we're attending to. So how do we balance that? And so the guests that we have all are folks who have that mindset, heart set. And so it's been a wonderful learning experience because, I'd never been a podcast host before. And so, but I love learning and connecting and talking with people because, that's just what I do. Just like on my everyday, grocery store run. And so it's wonderful to be able to get to do that in this capacity. And I love the people that I work with, our guests, and also my colleagues who I get to work with at Good Days. And so I encourage everyone to not only check out empoweredus.org for not just my podcast, but the other hosts and podcasts as well, but also to check out mygooddays.org, and specifically to learn more, I would like to emphasize more about Chronic Disease Day. And actually they have a sister site, which is chronicdiseaseday.org, where they kind of house a lot of their events and advocacy work. And this is hugely relevant, y'all, to us as caregivers, because one of the things that I learned is that 40% of us are dealing with have two or more of our own chronic health issues that we're dealing with as caregivers that we may have already had when we started, or that develop and are exacerbated by the stress and the physical and mental demands of caregiving. And so there's a connection here, you know. I mean,
Yes.
I've walked through that experience myself. And chronic diseases account for 7 of the top 10 causes of death in the United States. And, you know, many of these are unpreventable chronic conditions, okay? But as it turns out, that the deadliest and the most costly chronic diseases are also the most preventable. And so that's where Good Days comes in and helping to spread awareness, because, again, it's like, okay, when I think about, like, you know, a lot of the campaigns and that go on around, you know, certain initiatives, a lot of times, you know, we're using this language of building that we want to build awareness, okay? And so as just like a regular person, I'm like, okay, yeah, whatever, we're building awareness. But you know what? That is key, because if we're not aware that this is something that we as caregivers are likely to encounter and to have to deal with, then we're not in a position to be able to prevent it and to be mindful of what we need to do in order to make sure that, as I mentioned before, this idea of remaining whole and setting boundaries. And I came across this quote, because whenever we talk about setting boundaries and its relation to, you know, self-care and awareness and preventing chronic illness, those sorts of things, that's all related to boundaries. And when we use the word boundaries, there's almost like this, if you're a person who walks through the world leading with your heart and your soul, when you hear the word boundaries, there's almost like this visceral, physical reaction that feels like boundaries means something negative, that it's something negative, that it's something negative. And so I came across this quote, and I was like, oh my gosh, that is it. And it's by an author by the name of Prentice Hemphill, who says that boundaries are the distance at which I'm able to love both you and me.
I like that.
Yes.
Yes. Oh,
and
yes.
So if we think of boundaries in that way, that boundaries are the distance at which, and I'm not getting it exactly right, are the distance at which I'm able to love both you and me. If we use that as the context for how we set our boundaries, and think about that in relation to how we take care of ourselves, how we speak to ourselves about what we need to take care of ourselves physically, emotionally, spiritually, financially, all of these things, and its connection to preventing and awareness of chronic illness, then I think that is that can be helpful for many of us who might otherwise be less inclined to set those boundaries.
Oh, yes, I agree. Wow, Dannelle, that would be like another great show. I have to have you on again because, self-care and boundaries, that would be a great show. I have to have you back.
I'd love to come back.
Because that is so important. And I'll tell you, folks, what Dannelle is saying is the truth. I'm very fortunate, and I I give God the glory. I thank God every day. I made it through 10 years of caregiving with Matt, 5 years with my mother-in-law, and I'm without a lot of problems. I mean, I have some minor issues, but thank God I am intact. Was I exhausted? Yes, I'm still recuperating. 3 years after the fact, I'm still recuperating from caregiving. And it does take a lot, out of someone for sure. And I have to thank you, Dannelle LeBlanc, for coming on. And you're so passionate. I love that. And can you tell folks where they could reach you? How can people get in touch with you?
Yes, sure, absolutely. So you can connect with me via my social channels. I'm on Instagram at Dannelle Cares. That's DANNELLE Cares. My Twitter handle is You Deserve Care. And you can also contact me via my website, caregivertransitions.com.
Awesome. Thank you so much, Dannelle LeBlanc, for coming on. Folks, get in touch with Dannelle. Download that free caregivers community guide, caregiving community guide, and it's for free. I mean, that to me is a no-brainer. I'm from New Jersey. I'll just tell it like it is. If people don't download that for free, they're foolish, okay? I'm going to just put it out there. I'm a Jersey girl. I would be downloading that right after I hear this show if I was a caregiver, because it's important information. I mean, just valuable information and for free. And thank you for that, Dannelle. And I want to thank the listeners. Please share this show to help other people, because when you share this show, you are helping me. My mission, my vision is to help as many people as possible. And we all can benefit from Danielle's guest appearance and her resources that she has and her information. The information for I can't even talk now. Dannelle LeBlanc will be in the blog that Jeannie White, the station manager, writes. And thank you, Jeannie, for doing the blog and producing the show. And I want to thank Lillian Caldwell, who's CEO of Passion World Talk Radio, who makes this all possible. And you can subscribe to my show for free on iHeart and Spreaker. You could listen to my show on Passion World Talk Radio Network.com. And tell your friends about Chatting with Betsy, because I have phenomenal guests on. If I have to toot my own horn, I will. Toot, toot. I have great guests on. I learn from my guests. I do. From every guest, I learn something. And I get excited, folks. I'm excited about my show. And, there's, guests who everyone can benefit from. And you don't have to be a caregiver. This show is not just for caregivers. It's for anyone. And it can, people I have on, the guests, can help anyone. And you're never too old to change and to learn. I'm going to be 65 next month, and I'm still learning, and I'm still growing, and I'm still changing. Thank you. Thank you very excuse me. Thank you very much, Dannelle. And as I always say at the end of my show, folks, in a world where you could be anything, to please be kind, shine your light bright, because if we were all kind and shined our light bright, this would be a much peaceful and brighter world, and we certainly do need that now. And just, love up on each other and be good humans. And, Caregivers Month, yes, I'm passionate about it because I was a caregiver. Actually, I'm still a caregiver. But you people, you know what? I'm going to give some tips real quick. If you're making a casserole, make an extra one. A caregiver, say, hey, I have a casserole. I'll drop it off at your door. You don't even have to let me in. Are you home? I'm dropping it off. Throw in a gift card at Dunkin' Donuts or someplace if you can afford to do that. But it doesn't cost anything to send a text or an email to say, I'm thinking of you. How can I help you? I'm here for you. And that's what we need. Actually, I wrote a poem a long time ago, and I'll just say it real quick. What a caregiver needs. That is 2 ears to hear them without judgment, a shoulder to lean on, and 2 arms for a hug. That's what a caregiver needs and wants. And that is exactly how I felt when I was caregiving for my husband. And Matt is and always will be the catalyst for all that I do. And also when you share the show, you are helping me carry on in Matt's honor and his memory. So I want to thank everybody for that. It means so much to me. And that's all I have to say today, folks. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio. Bye-bye now.